Hi, Jordan, and thank you for taking a few minutes to talk with me today. As part of your dental hygiene appointment, I would like to ask you about tobacco use because it can have a significant impact on both your oral health and overall health. Would it be okay if we spent a few minutes talking about your smoking habits today?
Sure.
Thank you very much. And do you currently use any tobacco products such as cigarettes, cigars, vaping products, or even smokeless tobacco?
Yeah, I smoke cigarettes.
Thank you for sharing that with me. And how many cigarettes do you smoke in a typical day?
About a pack a day.
And how long have you been smoking?
I'd say around 12 years.
Thank you for sharing that. Smoking that much and that many years can definitely become part of your daily routine. Have you ever tried to quit before?
Yeah, a couple times.
Can you tell me about those experiences and what it was like when you tried to quit?
Yeah, it was really hard. I got really bad cravings and became stressed.
Yeah, quitting is definitely a hard thing to do, and it's really great that you've tried to quit before. What do you think helped you during those times when you tried to quit?
I just tried to stay busy, exercise, stuff like that.
Those are great options to help with quitting, and that's great that you implemented those. What situations or feelings usually make you want to smoke?
I'd say high stress, and just when I have my morning coffee, I usually want a cigarette with it.
Yeah, those are definitely situations that would make you want to smoke. And what concerns, if any, do you have about continuing to smoke?
I worry about my health.
That's a valid reason, and quitting smoking will definitely improve your health. And what are some other reasons to make you consider quitting?
I just want to be healthier and save money.
It sounds like your health is really important to you, and you've already shown that you are capable of smoking by making quit attempts, and that's something to be proud of. On a scale of 1 to 10, where 1 means you're not ready at all and 10 means you're completely ready, how do you feel about quitting smoking?
I'd say I'm an 8.
That's great. And why do you feel like you're an 8 and not a lower number like a 4?
Because I know smoking is hurting my health and I really want to quit.
Those are powerful reasons. And what positive changes do you think you would notice if you successfully quitted smoking?
I'd breathe easier, save money, and just feel better overall.
Those sound like excellent goals, and thank you for sharing that with me. I do have a sheet here, and it does actually show some of the health benefits if you quit smoking, and those are some of the health benefits you would experience. And as your dental hygiene student, I strongly recommend quitting because smoking is one of the most important things you can do for your oral health and your overall health. As your dental hygiene student, I strongly recommend quitting smoking because it is one of the most important things you can do for your oral health and your overall health. From an oral health perspective, smoking significantly increases your risk of periodontal disease, bone loss, tooth loss, delayed healing after any dental treatment, oral cancer, bad breath, and tooth staining. Smoking also decreases blood flow to the gums, and this means gum disease is sometimes can be even harder to detect because your gums might not even bleed as much, even when disease is present. How do you feel after you hear about the effects of smoking that it can have on your gums and your teeth?
It's concerning.
It can definitely be concerning, but the good news is that quitting can significantly reduce many of these risks. Smoking also affects your overall health and increases the risk of getting things like lung cancer, stroke, high blood pressure, diabetes complications, and secondhand smoke can also affect your family members and children around you. Another thing that can happen would be if a pregnant person smokes, it can increase the risk of miscarriage, premature birth, low birth weight, or even sudden infant death syndrome. After hearing about all these effects smoking can have on both your health and your overall health, what concerns you the most personally?
I think the possibility of losing my teeth and developing serious health problems worries me the most.
Those are very valid reasons, and the good news is when someone quits smoking, many of these risks begin to decrease over time, and your gums can heal, and once your oral disease decreases, you can make significant improvement on your overall oral health. Based on our discussion, it sounds like quitting is something that's important to you. Would you say you're interested in quitting within the next month?
Yeah.
That's wonderful. And what makes you feel like right now is the right time to quit?
I want to improve my health before it gets worse.
That sounds like really strong motivation, and I believe you can do it. Would you be willing to set a quit date within the next 2 weeks?
Yeah.
Great. So let's choose a quit date for you from 2 weeks from today. Since stress seems to be a big trigger for you, let's talk about some strategies that can help you when cravings occur. So some things you can do is you can go for a walk, you can do some deep breathing exercises, drink some water when some cravings come on, call a supportive friend or family member. You can chew some sugar-free gum, keeping your hands busy, exercising, and avoid smoking triggers during the first few weeks. Which one of these strategies do you think is going to work best for you?
Probably walking and exercise.
That's an excellent choice. And you've already identified these strategies have worked for you before. There are also many other things that can help you quit smoking, like there is some nicotine gum, the patch, the spray, and there are also medications available that can help you with cravings and withdrawal symptoms. I can go over those with you, and if you feel like they are an option, you will need to reach out to your primary care doctor or nurse practitioner. Are you okay if we go over some of those medication options?
Yeah.
Okay, so one option is Zyban. Zyban is actually classified as an antidepressant medication, but it works by increasing dopamine and neuroepinephrine levels in the brain, which help reduce nicotine cravings and withdrawal symptoms. And another option would be Champix, and Champix is classified as a smoking cessation medication. It also works by partially stimulating the nicotine receptors in the brain while blocking nicotine from cigarettes. And this helps reduce cravings and making smoking less satisfying if someone does smoke. Champix is also considered one of the most effective smoking cessation medications. And although it might be more expensive than Zyban, you can reach out to your insurance and see if there's any coverage for it. How do you feel about using medication as part of your smoking plan?
I think it could help.
That's great. I would encourage you to speak with your physician or your nurse practitioner to determine whether those medications are a good option for you. I would also like to provide you with some resources to help quitting. I have a pamphlet here, and it has the Smoker Helpline pamphlet, the Canadian Cancer Society Quitting Smoke Resources line. There are some government tobacco cessation resources, and quitting smoking mobile apps are also available as well. These resources provide education, support, and access to train quit courses if you need any additional help. So I'm going to give that to you, and you can hold on to that to reference back to.
Okay.
Do you have anyone in your life who can support you during this quitting attempt?
Yeah, I'd say my spouse and family.
That sounds like you have a great support system, and having support from family can make a big difference. So I'd like to make a follow-up appointment with you after your quit date to see how things are going and discuss any challenges you may be experiencing. So we'll set an appointment with you, and I can review your progress, celebrate your success, and I can help you with any challenges you may be facing. Does that sound good?
Yeah.
Okay, so what we talked about today is you currently smoke 1 pack of cigarettes a day, but you're interested in quitting, and we chose a quit date. Your main reason for quitting is wanting to improve your health and saving money. We discussed the effects of smoking on your oral health, your gums, and delayed healing, and we also discussed that it can cause oral cancer. We've discussed overall health risks, and we've identified stress and coffee as your smoking triggers. We will review coping strategies such as walking and exercise and deep breathing and family support. We also discussed for you to reach out to your family physician to access any medications you may need, and then you have the pamphlet for all of the resources I recommended there for you. Does that all sound good? Do you have any questions?
Yeah, no questions. Thank you for all your help. You've really motivated me to quit. I really think I can stick to it this time.
Awesome, and I appreciate your willingness to discuss this with me today. You've already identified several strengths and motivations that can help you succeed. I believe you have a great foundation for a successful quit attempt.